I'd like to welcome everybody to the Mesa City Council meeting for Tuesday, March the 31st. Again, this is our what is now a regular Tuesday afternoon meeting. During the coronavirus situation, we're meeting on Tuesday afternoons and also Thursday mornings at 7:30. All of our council is present with the exception of Mr. Heredia, and we will, if he joins us during the process of this meeting, we'll make sure we make note of that. The first item on our agenda today is to hear a presentation and continue discussions and provide direction on COVID-19 impacts, responses, and the city's future actions, focusing on public safety and community resources. I see we've got both of our chiefs online with us. Chiefs, welcome. Mr. Brady, how would you like to proceed?
Thank you, Mayor. I think we'd like to go similar to what we did last week. We have Chief Camelli here. She has some information to bring you up to speed on related to her area, and then Chief Costa is also prepared to share some updates with the council, and then we can certainly, during their presentations, answer any questions you have. Oh, and Mayor, I think, are you there, Frankie? Wave, because we're not sure. Is that you? There he is. Okay.
Okay. Thank you, Mr. Brady. Mayor Giles, members of the council, thank you so much for having us. And we want to give you an update on where we are. First of all, I have to say that our members out there, both behind the scenes and in the streets, are doing an amazing job. They continue to be exposed, but we are doing all we can to minimize the risk by making sure that they have the proper equipment to really reduce their chances of getting sick or catching this virus. So PPE is probably our #1 issue, not only for Mesa, but across the nation. As of today, we do have enough masks and enough gloves to say we're comfortably set for at least a month. And that's sitting pretty good. We have orders out there to get them in as they become available. Also, in addition to that, we just received 18,000 surgical masks, thanks to the help of the Mayor's Connections. We purchased 18,000 surgical masks. That's going to be very helpful to us because with these surgical masks, we put them on the patients. And that's just another barrier, another line of defense to help protect our members whenever we think there's an exposure out there. So we'll continue to monitor supplies and get those in. Another thing we have, if we ever ran out of these N95s, that it came to that, also what we have in stock is we have enough of, it's called the P100 masks. And if you could see this somewhere in the camera, the P95 is a little more cumbersome, but this is a mask that we can use for our members if need be. We have several hundred in stock. So our members just know there's a backup if we couldn't get N95s and maintain that stock. Other than that, gowns are probably the thing that we have the least amount. We're trying to preserve the gowns we have. When they are used on calls, we try to disinfect them, put them outside to kind of make them so we can reuse the gowns when needed. Also, we also have a good supply of hand sanitizer. All these things are really, really important for us as we move forward in trying to minimize our folks and their risks. We've been asked about our strategic national stockpile. So the SNS, we're waiting for the third shipment of those supplies. On the first shipment, we received 195 masks. And then we also received 150 called stay packs. These are packs that have individual like gloves, mask, gown. We've given those to PD to put in their vehicles when needed. It wasn't enough for all of their officers, of course, but at least it's something. When the national stockpile comes in, just so you know how the order of distribution is hospitals are first, long-term care facilities are second, essential health care is third, and first responders are fourth on the list. They also monitor our daily use. We turn that into the county. They know how much we have in stock, and then they base what we get on that as well. So that's what's going on with our supplies in that regard. We are taking our members' temperatures every day to make sure that no one comes in with a fever. They're sent home if they do have a fever. Something that we've changed in our approach to responding to these calls, our dispatch center is doing a great job in asking all these important questions, if there's any signs and symptoms of flu, things like that. So what we do is, as we are approaching these scenes, one person walks to the door. If the patient is ambulatory, we ask the patient to meet us outside. We want to minimize the risk. We treat the patient in open air whenever we possibly can to kind of reduce the chances of us walking into someone's home having the entire crew impacted by this. So we ask the patient when they're able to meet us outside. One person will walk to the door first, and then we'll treat them outside. We're actually putting a chair on each of the trucks. That's happening today. So when we walk someone outside the door, they have someplace to sit, and we will have them sit outside while we're taking their vitals and assessing the patient whether they need to go to the ER or not. Where our crews are disinfecting all of their equipment, we have enough disinfectant spray at this time. So we continue to make sure we do that, whatever we can on the scene. And when they come to the station, they do that outside the bays as well. So we reduce the risk of exposure there too. When we can use it, we're using the 10% bleach water as well. Our responders are exempt from quarantine because we've been asked, if we get a COVID patient, are we going to be quarantined? First responders across the nation, we are really exempt from that because as you notice in New York, they started doing that and they had to call back these doctors and nurses because as they were getting quarantined, their medical staff was less and less. So we do not quarantine when we're exposed. To date, what we know of is we had one positive corona. Now, in saying that, we are anticipating there's many more out there that have not been tested. So we treat all these patients as though they have the virus. The crew that did respond to this patient, we have not been advised of any illnesses that they've received since then, but it does take about 14 days to see if there's an impact to that or not. So we monitor that very, very closely, but we just anticipate that the calls we are going on have the coronavirus, and we anticipate the worst and protect ourselves in that regard. They're just opening it up now. Banner is just now going to open up their facility in terms of testing for firefighters. If they have symptoms, they're going to be able to go and get tested to see if they do have, if they have symptoms, get tested and see if they do have the virus or not. Just so you know, with all this, this does really cause a lot of stress to the members as well. Our peer support team is doing a great job. Whenever a member is sick, our peer support reaches out to them, see what their needs are, even if they're off on bereavement, things like that. We also have a crisis counselor that works with us part-time. She is available to our members as well. As they're going through this, it's just stressful for them and their families, what they bring home. So they're really conscientious about that as well every time they leave the station in terms of not taking germs home to their family. As you know, you've been getting daily updates from our EOC, and you will continue to do that. Mr. Brady asked us to send this out to you. You will be getting those daily reports. One of the things that they have asked us to do is look for facilities in Mesa, if need be, if we needed another location to house if the hospitals became overcrowded. So if need be, we've identified a few hospital facilities in working with Mr. Brady and Mr. Pombier. And so we will evaluate those and send those into the county as well. Some old hospitals that have been shut down. If you've watched the news, you saw that Phoenix St. Luke was one of the ones. They already had the Army Reserve go and evaluate that building. That can house over 200, and they could fit actually more beds than that in other areas of the hospital if they need be for potential coronavirus patients. However they do that, non-corona or corona, that'll be up to the county and the state when they come up with those, evaluations on that. Also, you'll see here on a chart that we've been referencing that just came available actually 5 days ago. And it's about the projection for Arizona of when our peak time is. And this changes daily. So if you see here, it says April 26th is when we're going to be at our peak time. And we can send you this link as well through the EOC update. But this is after looking at this is one of the better projections that we've seen. This came from the University of Washington. And this was designed to see what hospital beds are available, how many ICU beds they're going to need, how many ventilators they're going to need. And the county and the state are working on these very, very issues. We see that we're a little later. New York and all back east, their peak dates are like early April, and you see ours are late April. And it does change by day. They evaluate social distancing, all these other things they put into this to determine when our peak will be. So this is where it is for Arizona right now. Some of the programs that we put on place since then is our social services program. This is when we were going out to the high utilizer calls, things like that. They are reaching out to these patients that are either high utilizers or the most vulnerable. When we go on a patient that's very vulnerable, lives by themselves, our crew lets our social services team know this. They make phone calls. They reach out to these members to see what they need. And the average age of these folks is 71. So they've done it. They've been doing it the last couple of days. Really, some very positive results from this. They have members saying they're really happy. The city called to check up on them. They were feeling extremely isolated. They felt very comfortable that someone from the department had reached out to them. We also had shared Mayor Giles' program with the grandparent, adopted grandparent, that information with them as well if they need other services. So that's something that's going on now. And the last program we're looking at implementing here is a couple of two-person units, a medic and an EMT. It's going to be called the MTU, the mobile triage unit. This is region-wide, and these will be set up to go on COVID-type calls. And that way we minimize the risk of exposure to our members. Also, that something we'll be doing with this program is, we've never done this before, is stat calls. So if it's a 30-minute response, we'll advise the caller. If it's just flu-like symptoms, it's not life-threatening, but someone's feeling sick, we will also stat calls with this program to ensure that we send these two-person units out on these calls. And we're looking to start this program either the end of next week or early of the week of the 13th. And those are updates for now.
Thank you, Council. Questions for Chief Camelli? Okay, Chief, I did have the chart that you were referencing earlier. That looks. I tried to zoom in on it, but I couldn't quite make out what is that peak date.
So the peak date is April 26th, and that's where but we have it shows about 4,800 patients in the state of Arizona, and we'll send you this link as well, Mayor. But it shows that at our peak we'll be at about 4,800, and it's very, very fluid because at 5 days ago when this link came out, we were at about just over 5,000. So the actions we are taking today in terms of social distancing impacts what the projections will be. Also, it shows you that's the peak time. How long it's going to last is going to take us into June, just in the very beginning of June as well. And it shows you how many ICU beds you're going to need. It's about 222 ICU beds. So it shows us those things as well, which are very important. And available beds. It shows you available hospital beds as well. So there's 6,000 hospital beds. It shows at peak we're going to need 4,800. But where we're going to be lacking is ICU beds. But hospitals can work that out and determining as they get. The county's already working on getting more and more ventilators, so they're working that out too.
Okay, so these projections wouldn't create the scenario you were describing earlier, where we need to find places to hospitalize patients in addition to the existing hospital facilities.
That is correct. As of right now on this data, it shows that the beds available and the number of patients at peak, we should be good in Arizona. Now, Maricopa County, they say 20% of the patients that actually get the virus are the ones that are hospitalized. So if they're showing 5,000, that means there'll be approximately 25,000 cases in Arizona. And so, Maricopa being the largest, we could just project how many would be in our county.
Okay, thank you. Council, any questions for Chief Camelli?
I got one quick question, John.
Okay, Jeremy.
Hey, Mary, have we had our team look through these numbers, or anybody just to double check? I don't know what the source of this data is. I love the website, and I want to, I know Dale had sent this to me a couple of days ago. So thanks to Dale for sending that out. But are we actually doing any of our own internal research just to make sure that these numbers are coming out the way we expect?
So, Mayor, Councilmember Whitaker, we do have, the county is tracking, we track in our alarm room too, the available hospital beds for Maricopa County. So we know the hospitals in our county, what are available beds. We don't do the entire state. So in terms of, for Maricopa County, that looks pretty accurate based on numbers, but we can't say for the whole state. But we do track hospital beds when they're available. Our alarm room knows how many beds are available when they're on diversion or can't take any more patients. At this time, the hospitals are doing very, very well. They're not overcrowded at this time. Our call volume is somewhat down also, but this shows when the peak of these types of calls is coming.
Okay, thank you, Mary.
You bet.
Thank you. Oh, Jen.
Yes, regarding, first of all, on the slide, is it possible to project that so that we can see it full screen? Or am I not doing something right? I'm not able to see it other than just the kind of a gallery view.
You know what, if Channel 11 has to do it from their end, I believe.
Yeah, I checked channel 11 and it's just showing, but anyway, then can I get the website on that? So that
Absolutely. We can
see
send you the
that?
website.
So you can
Okay.
go to, it's covid19.healthdata.org.
Thank you, Mr. Brady.
Okay, thank you. And then you said at the peak of 26, around April 26th, 4,800, now those are hospitalized cases?
That's correct. Those are, Mayor, Councilmember Duff, yes, the 4,800 that they show, this whole graph of projection is who is in the hospital. And so it shows there'll be 4,829 beds used by patients that have the virus.
And we have beds available?
And in Arizona today, it shows over 6,000 beds available. Now, that's the whole state, it's the entire state, so depending on how many are in Maricopa, we'll evaluate that. That's why having a hospital just in case and looking at resources that may become available, we're prepared ahead of time. If we don't use them, then, but at least we were ready if we needed them.
And so we don't know specifically by Mesa as far as, I know patients can go to other areas of the valley, especially in the, in the valley area, but I didn't know in Mesa what our availability was.
Yeah, we track our hospital beds today. We know our alarm room has what's called EM tracking, and we track the hospital availability for every single hospital that we have in our city. So when our folks are transporting someone, our alarm room, if they couldn't go there for some reason, our alarm room advises our company officer that that hospital's full. And if, usually if a patient's very sick, we take them to the closest facility. But if it was overcrowded and we took them somewhere else due to time, we can do that as well.
And as of today, fine.
Yeah. Right. Today was
Did any one of our facilities, hospitals?
I'm sorry, you broke up, Councilmember Duff.
Have we run out of any ice beds at any of our hospitals, Mesa?
No, at this time, our hospitals are doing very well in terms of they're not at capacity yet.
Okay, thank you.
Mr. Luna had a question. David.
Hey, Mary, thank you for that great presentation. Are we considering maybe opening the old Mesa if we have? That's a large facility. Have you worked with Banner to look at that as a possibility?
Mayor, Councilmember Luna, thanks for that question. We did identify different locations. I think that wasn't one that was available at the time, but in working with Mr. Brady, Mr. Pombier, we looked at some of the old Mesa General. Part of that's being used for truly critical patients, but the other half is still available. We did identify potential use as the old Hacienda Children's Hospital that's vacant as well. These aren't very big hospitals, but if they needed some space, those hospitals, we're looking into those right now. And once we'll send those to the county. We've talked to the county about it already.
So Mayor and Council, one of the things that helps us a little bit, but works against us, we don't have in Mesa, except for the Desert Banner, we don't have, the newer hospitals, I should say, are not large hospitals, but the two hospitals that we have over on the east side off the 60 in Crisman and down at Elliott and Ellsworth, they do have beds available, but so does Banner. So right now we're sitting pretty well. The hospitals are not overwhelmed, but what we're planning on, as you can tell from this chart, is everybody's trying to gear up for the next 45, 60 days, because even if this peaks, Mary, correct me wrong, I think we're talking about it peaking on the 26th, but the bed, the hospital bed peak is actually further out in May. Am I saying that correctly?
Right. So actually, yeah, April 26th is the peak time, and the hospital bed use, they have enough beds. They're just going to run out of ICU beds. According to this projection, they may run out of ICU beds, but the bed availability will be there, and that's true. And it does go all the way, actually it takes us all the way till June, the first part of June. So the end of May, first part of June. And in terms to address what Mr. Brady's saying is, we did some research and we saw that the national average of bed per 1,000 was 2.4, Arizona was 1.9, but in Mesa alone, we averaged about 2.4 beds. We were right there in terms of the hospital space we did have. That's Mesa alone. We just did our own numbers.
Okay, thank you. Council, other questions? Mr. Freeman.
Thank you, Chief, for the report. Couple of questions. What is the time of confinement for a patient in the ER if they're ICU and then moved out to the floor? And then a follow-up question is, if you are going to implement this other response units, is that qualify for federal funding, a part of the stimulus package that will come to the cities? Two questions. Thanks.
Mayor, Vice Mayor Freeman, to answer the question, in terms of from ICU to the floor, that I don't know, but I do know that if someone tested positive, they would have to wait 7 days, and then if they receive symptoms after that or right at that time, they'd still have to wait 3 additional days without symptoms after symptoms occurred. So anybody that tests positive to corona has to wait at least 7 days before they are come out, and also another 3 additional days if they did receive any symptoms. So that much I know in terms of if they tested positive. In the hospital, I'm not sure. And your second question is, yes, we would anticipate that this could be reimbursable with federal funding because it's a program that will be set up specifically for COVID response. And so we're anticipating that this would be cost recoverable.
So what we'll do, Mayor and Council, is there's a lot of programs that we're rolling out in response to COVID. We will code them or account for them specifically separately so that when those programs and the dollars are available, we'll be able to identify this activity specifically as an activity related to COVID. So we'll do everything we can to track it this way now. And then we'll talk a little bit later about all the dollars that are coming to the city and how we're going to keep trying to track those so that we can see if we can get reimbursement for those expenses.
Okay, Mary, another question occurred to me. Is this model, I don't know when it was prepared, but is it corresponding with the actual numbers that we're seeing unfold over the last few days? And if what are the assumptions on social distancing for this model? For example, the governor yesterday kind of escalated the level of stay-at-home order. Does this model assume a more or a less aggressive social distancing model than what we're using right now?
So, Mayor Giles, members of the council, that is a great question. Mr. Pommy and I just had this conversation about the stay-at-home order. Yes, this does follow. I looked at the facts behind the data, and it does say it's updated every single day, and it does take social distancing into account and these kind of stay-at-home type orders. I'm not sure why they didn't change it today, although when this came out 5 days ago, April 19th was the date of our peak. And since then, because of what Arizona's doing, it put our date out. The numbers went down as well. It was over 5,000 initially, and now it's 4,800. So they are taking certain things into account that are being put in place throughout the state. The stay-at-home order, I don't know why that wasn't changed, whether they felt like, so I really couldn't answer why they didn't change that based on the governor's statement yesterday. But it's very fluid, it changes daily, and
Okay.
they do take those into consideration.
Great. So if we want to see a real-time impact on this chart, we could go to the website you gave us earlier, and we could see how if we're flattening the curve or if the estimates are changing.
Absolutely, Mayor Giles. This would be helpful to us. We're using it as a projection for folks that are hospitalized, and then we just assume, how many are out there that are also sick that are not hospitalized. But yes, it gives us a good idea of who's going into the hospital and what kind of availability we will have for our patients.
Okay, thank you very much. Council, any other questions for Mary? Okay. Yes, Mr. Thompson.
Sorry, just popped into my head. Chief, from the homeless community perspective, are we seeing any degradation in their health, being more vulnerable than we are in the general population?
Okay. Mayor, Councilmember Thompson, we don't have that information, although the county is tracking that with the homeless as well. I know Natalie Lewis is doing things with the homeless too, but in terms of tracking the homeless, yeah, we don't really track it that way, but the county is trying to track that for us and give us information in that regard.
Yeah, so Councilor, we'll let Natalie talk more about the outreach, but the county is pushing the cities to look for opportunities to provide safe and healthy places for homeless. They are not sharing with us
James, we're
where
just-
those cases are being identified and who they are, so we don't know. But we do expect there is great vulnerability in that population. But we'll talk more about that. I think Natalie can shed some light on some of that.
Okay, I was just curious as if they knew how many of those that are already have tested positive were homeless versus non-homeless,
No, we don't get that. They don't provide that
or
information.
if they're even tracking that.
Well, I don't know. I don't know what the county, what information they have, but the information they have is, what they share with us is very limited. It's just essentially what you see on their own webpage. I think it's that summary that we provided you last night in our, what we sent out to council. That's what we get from the county.
And to add to what Mr. Brady just said, we just found out from the county today that all they're tracking really for the county is the positive corona patients that are homeless.
And Mr. Mayor,
Okay,
Mayor,
yes,
Council,
yes.
the site we provided you is one of many modeling sites, and I want to caution you in the use of it, only that a lot of the sites have different assumptions and show a lot of different varying strengths of the curve. They all seem to agree that we will reach our peak towards the end of April, but they use different assumptions with different numbers, and so I caution you, that's one of many sites. We find it as a good reference, but it is by no means can we guarantee the accuracy of that data or their assumptions.
Okay, thank you, Mr. Pombier. I think, are we ready to move on to Chief Cost, Mr. Brady?
Yes, sir.
I actually have,
Oh.
I've got one other question, if I may.
Oh, I'm sorry, Jeremy, go ahead.
On this website, Mary, it's projecting how many ventilators are needed, but it looks like the number is missing as far as how many ventilators actually exist. Is there another reference that you guys are using as far as the ventilators go, or what are we doing as far as that?
I know that the state mentioned, Councilmember Whitaker, the mayor, I'm sorry, the state is also tracking, trying to get more ventilators at this time. It does say that there's 584 that are needed. And so the state is already out there seeking to get more ventilators today. Dr. Christ has been out there saying they're trying to get more ventilators to meet the demand. And as Mr. Pombier said, this is one site, but it's helpful, but there's many other avenues out there in terms of the equipment and things like that. But we know, or they're assuming that they're going to need more ventilators, and they're already working on getting those. And we have ventilators here that we can also, we have 37 that if needed, we can contribute that to hospitals as well.
Okay, perfect. Yeah, that was going to be my other question, is that I know that we had said that we had some on staff and, in supply, but 37 is a decent amount relative to the fact that they're saying we're going to need 584, it looks like.
Right.
I don't know if that's at the peak or throughout the whole thing, but I mean, obviously if the local hospitals could use those, I would assume more than we could, maybe we could make sure we're reaching out to them when the time does come up.
Yep, absolutely.
Thank you, Mary.
Uh-huh.
All right, thank you, council. If there's nothing, Mr. Brady, are we ready to proceed with Chief Cost?
Yes, please.
Mayor, Council, good afternoon. I want to reiterate what Chief Camelli said as far as our first and foremost, our mission and our goal is the safety of our members and the safety of the public. If we had the biggest challenge right now, it's the same. I meet with the Major City Chiefs Association every week. Everybody is having the PPE issue that we are having, along with fire. I will report that the working relationship between us, and I want to publicly thank Chief Camelli and Mesa Fire and Medical, because they have provided us some PPE gear in the interim to make sure our officers meet just the minimum requirements that the CDC has. We had plenty of gloves. There's just some of those items that we did not have that everybody's having trouble getting, and masks were one of them. And she's replenishing our mask volume right now as we wait for the surplus to come in. As far as crime goes and calls for service, a quarterly comparison between January and now, we are down just about 3.7% in dispatch calls for service. So to give you an idea, that's fairly nominal. It's 117 dispatch calls for service that we're down. What we're doing is we're keeping an eye on the different categories. As this is new for every law enforcement agency, we're keeping an eye on those categories and looking at our data day to day to see if we're having a spike in, for example, domestic violence and neighbor disturbances, or any related calls because of the fact that so many people are working from home. And then, of course, as of 5 p.m. today, the expansion of the emergency order. So we're tracking that, and we will be on that hourly, daily, to make sure that we put the resources where we need to put them for the newest orders, especially within our parks and those areas. We're having our officers go write their reports or do extra patrol in those parks and in those neighborhoods that have been affected. So there's visible police presence out on the street, to include all of our closed businesses and areas where whether it be Walmart or Target or a food distribution site. Our officers are there to basically do extra patrol and make sure that we have high visibility. So we've had that drop, but we've reallocated resources based on this COVID emergency that we're in right now. We've also included steps to screen the calls. That's going very well. We were screening calls, I believe, both fire and police before the CDC even came out with that guideline. And I'll tell you that's been highly successful in getting people outside to help mitigate the contact that our officers have with people inside their homes, and to be able to create that distancing. Of course, our officers are going to have to put hands on people at times to do their business, but so they are prepared to do so. And it's just a matter of getting enough of that PPE gear to last longer just than the few weeks or a month supply that we have now. But we have people working on it 24/7, and they're working on it as we speak. My email is going crazy just with new updates on PPE. Our officers are all doing well. Our absenteeism is steady and actually lowering than the prior months. So, our folks are doing the job that they've always had, and providing that service to the citizens of Mesa in an exceptional manner right now. And very proud of the men and women and the work that they're doing and all the work behind the scenes.
Thank you, Chief. Council, questions for Chief Cost? All right, I'm not seeing any. Mr. Brady, anything else on this agenda item?
Not on the public safety. When you're ready, we can move to the next item.
Okay, thank you. Let's move to the next item then. This is I don't know that I need to read all of this, but it's to hear a presentation, discuss and provide direction on updates on recent federal legislation, state funding, COVID-19, focus on available federal funds, including allocating available CDBG funds towards serving Mesa's homeless, low, moderate income families, elderly, and other at-risk populations.
So, Mayor, let me.
Thank you,
Let me just start with a brief kind of introduction, and then I'm going to hand it off to Natalie and Michelle. So, as council knows, we received a high-level briefing from Mr. Butler, I believe last Thursday, where we know that President Trump has signed the $2 trillion CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. He signed that on March 27th. So $2 trillion is obviously the largest stimulus package that has ever been approved and made available to the country in its history. And so one of the responsibilities we have then as a local government is to really become aware of and find out what is going to become available to us and to our community over the next 30 days or so. And so to address that, we have just stood up or just standing up today what we call Mesa Cares. So we're looking at the specific act, and we're looking at the dollars that are coming directly or will come to Mesa in a variety of different ways, whether it's a direct deposit to us or whether it's through other federal funding, whether it's related to CDBG, whether it's related to small business, whether it's related to economic development, administration. We're looking at all of the different categories, and there's several. You can imagine $2 trillion, even as it comes down to our city and our state, is going to be a significant amount of resources. So one of the things that we have done, and I appreciate kind of the mayor's kind of nudging me along in this area, we are now organizing the city's staff, especially those who are now no longer have facilities in which they operate because they're closed. We're now redirecting a lot of that staff to be doing the first phase is helping us do a kind of a needs assessment throughout our community based on the categories that are available from the federal dollars. So we're going to be reaching out, and we've already started this, but reaching out to a lot of our communities related to homelessness, related to those who need utility assistance, rental assistance, food distribution, anything that may have impacted our community through COVID and that may be eligible under these stimulus dollars. We're doing a deep dive as trying to do an assessment. So we're using a lot of the staff that maybe worked in the libraries, worked in our public, in our parks and recreation facilities, in our museums and art centers, and we'll be redirecting them, working with all our different partners in the community, but also directly contacting community members and trying to make sure we come up with a very good identification of the needs in the community and creating those categories. And then hopefully we can begin to, working with council, bring some ideas about how we think those dollars can be best distributed to the identified needs. The funds are coming sooner. Some will come a little bit later at the end of the month or a little bit later, but we want to be proactively now working with our community, identifying needs and being able to put those in categories and try to define those so we can figure out when the dollars do become available to Mesa, how we can quickly distribute those in a manner that ultimately, when they are audited a couple years after all of this, we're not having to spend a lot of city general fund dollars to cover the costs that might have been ineligible. So that's what we're doing right now as a city. We're kind of we're pivoting a lot of these employees from what they might have been doing in their regular jobs and having them work in this area. We also hope that those efforts that they will be now providing as far as helping provide relief of these federal dollars will also make their time and their effort will also become eligible for reimbursement from the federal dollars. So we're trying to make this work a variety of different ways. So I don't know if any council has any questions on that. Otherwise, Natalie's here with Michelle, I believe, to discuss a portion of the CARES Act, which relates specifically to economic security, which relates to the CDBG and the social service side of the formula.
Thank you, Chris. Thank you, Mayor and City Council. What we want to do, and it is today, I'm joined today with Michelle Albanese. She's our new Housing and Community Development Director, and she and I have been working feverishly on this topic for the last couple of weeks. But as you all know, the stimulus package that came down that is now called the CARES Act is enormously complicated. And so one of the things that we're doing right now is tracking what is coming our way and trying to decipher exactly what that means for Mesa. So Michelle's going to be talking to you today about those federal dollars, what we know as of today, all understanding that this is a changing situation. And as it relates most specifically to our homeless population, to our low to moderate income family members, especially to those households that might be losing jobs right now, other at-risk populations such as our elderly. So she'll talk about the stimulus and what we know. And then I'm going to wrap up with some information about our local federal dollars. We have federal dollars that are already allocated to us. We now have more flexibility to use them. And what we are trying to do is identify some high needs and get some proposals and put those monies to work in Mesa as soon as possible. So with that, I'll turn it over to Michelle and let her get us started.
Thank you, Natalie. Thank you. Good afternoon, Mayor Giles, City Council members. In the face of the economic and social impact that's been caused by the coronavirus, Congress just recently passed 3 pieces of legislation which have been aimed at combating the virus and its impact to the communities. On March 26th, it's what they call the 3-phase stimulus package for the Corona Aid, Relief, and Economic Security Act. Under this specific act, the states are going to receive an additional $5 billion in funding, which is going to be made to the Community Development Block Grant and ESG, or Emergency Solutions Grant, for this fiscal year. This is the first bill that is going to provide direct financial assistance to aid the individuals who are impacted from the coronavirus. These additional funds will fund existing and new programs for CDBG and ESG to help prevent and prepare and respond to the virus as well. So on the screen, what you can see here is that for the Community Development Block Grant, the $5 billion is additional funds for preventing, preparing for, and responding to the coronavirus, which can be used for public service type activities, which could be education or prevention. It could also be supplies, Meals on Wheels, and we'll get into that more detail here later on in the presentation. And also for addressing facilities to create more beds for facilities or renovate existing spaces to help do quarantine for individuals. And then for our Emergency Solutions Grant Program, there's $4 billion that have been allocated, which is to prevent, prepare for, and respond to coronavirus, specifically for individuals who are either homeless or who are receiving homeless services right now, or some type of prevention for homeless folks. So for the next slide, for $2 billion, that's going to be allocated directly to states and entitlements. So the city of Mesa is an entitlement community. What that basically means is we receive funding on an annual basis from HUD based on a formula that's developed based on population and poverty and other socioeconomic factors. For the states, they're also going to be receiving $2 billion, which is going to go directly to the states and local governments based on the communities at highest risk, and also a new formula distribution that HUD is going to develop. So the first one that I spoke about for the $2 billion for the grantees is what's going to directly affect us within the next 30 days. So I've tried to break out a history of the last 2 years of funding that we received with our CDBG and ESG allocations. So for fiscal year 19-20, which is the current year that we have contracts with agencies, we received $3,729,487. For fiscal year 2021, for recommendations that we'll be bringing to you here fairly quickly, the estimated allocation is just over $4 million. And through the CARES Act, the CDBG allocation is approximately $2.3 million. That gives us really an approximate total of $10 million with these 3 years of funding. For the ESG side, in 19-20, we received approximately $308,000. Those again are under current contract. For 2021, we anticipate receiving $327,000. And this is a huge jump right here. For our CARES Act, we anticipate receiving $2.2 million, which brings the 3 years total of $2,896,000. Along with the act, not only does it bring additional funding for us, but it also relaxes some of the regulations and requirements that HUD has right now. So for instance, for CDBG, currently and historically, our HUD reports and plans that indicate how we're going to spend our money is due to HUD May 15th every year. This year, they're going to waive that and they're going to extend it to August of 2021. So we don't have specific details on that yet, but we know that there's going to be this extension of time. For our public service cap, those are the dollars I mentioned that can help with education, Meals on Wheels. That's typically capped at 15% of our allocation. They're going to suspend that both for our fiscal year 19-20, which is our current allocation, and our 2021, as well as the additional funds we're getting through this act. So that's really a great addition to help us spend the money. Public comment period. When we're doing a public comment period for the use of our funds, we're required to do a minimum of 30 days. In light of the situation with the virus, they're now going to require just a 5-day comment period. And of course, instead of doing that in person, we'll be doing that in virtual settings. To get into a little bit more of the details for the uses for CDBG for public services, can be used for testing, diagnosis, that can be fixed or mobile locations. And again, these are just examples that I'm giving because we're still waiting for exact details on what the money can be used on. Equipment and supplies or materials and meal delivery to those individuals who are quarantined in addition to supplies. For public facilities, we can use the funds for acquiring or rehabilitating existing facilities so that we can use it for quarantine space or medical relief, some type of use that helps with this virus. For ESG, eligible funds include shelter operations, which would be supplies or furnishings, equipment, such as cleaning supplies, bed linens, any additional supplies that really help agencies do direct delivery to the individuals in need. And then this is a big one here is paying for transportation. So whether it's bus passes, taxis, or providing some type of transportation for medical care, that is now included in ESG. In addition, we can use the money for street outreach, again, giving supplies. So when there's individuals going out and talking with homeless in the community, they can provide sanitizer, soap, and also that PPE, that protective equipment for the individuals going out into the community. And also for case management, which includes staff time for those agencies that will be funding. So as far as the next steps, we're pending HUD's release of the funds. We hope that it will be within the next 30 to 45 days, but we know it's a minimum of 30 days. We are getting information, as Natalie said, really on a daily basis. So hopefully, I'm sure HUD's working on some regulations and different resources that they're going to make available to us very soon. So we're really keeping in communication with one another to try to keep apprised of new information. We're currently assessing needs within the community, as the city manager mentioned, and also among our nonprofits that deliver the services. We're working to develop some preliminary ideas for programs and services that could include some of the services we already administer, or maybe it's new programs as well. And in that, of course, we have to work directly with our nonprofits to see what's going on in the community and what some of their needs are. In the meantime, until HUD releases the funds, we're going to be working on developing an accelerated application process rather than our 10 or 15 page application that we use on an annual basis. We want something quick and consistent that we can get out to those agencies and turn around really quickly. And of course, we couldn't do this without interdepartment collaboration. So I thank Natalie and Chris and all of the other departments that are working together with us. And with that, I would be happy to entertain any questions and then turn it over to Natalie for the remainder of the presentation.
Thank you. Council, any questions for Natalie or Michelle? Let's see, let's go with Mr. Luna and then Mr. Thompson.
Hey, Michelle and Natalie, I know this is going to be a heavy task ahead of you to try to look at all these applications and move them fast forward. Now, Mr. Brady said that possibly repurposing some staff to assist you in those efforts. I know I've been on the Community Culture Development Committee for the past 6 years as a city council member. It's always been a lengthy process to get these kind of approvals. Are you feeling confident that you can move through these applications quickly so that we can fund these agencies that badly need the funds to support our efforts relative to COVID?
So Michelle, I'll start with that if it's okay. Mayor, Councilmember Luna, I would say confident might not be the right word. I'm feeling hopeful. I do see that the federal government has made a lot of changes to give us much more flexibility in how we use these dollars. What has not changed or what we're still waiting for clarity on is if they're going to help us with the process. They've given us a few things, like Michelle pointed out in the presentation, but as it relates to what kind of documentation is going to be required, making the agencies actually go out there, spend the money, and then provide the documentation and request reimbursement is still part of what we have to do. So even though we do feel hopeful that we're going to be able to cut through a lot of this and we're going to try to make this as simple as possible, we're still dealing with federal dollars. So as we move forward into this process, and I'll talk a little bit more about this as well, is we will be looking for agencies that have experience working with federal dollars and have the capacity to do the documentation that is required, because that will be so helpful as we try to expedite this.
And I just real quickly, let me just weigh in on this real quickly. Mayor and Council, I think there's going to be, you're going to get flooded by a lot of nonprofits who want to, you're going to hear about these dollars and are going to want a piece of it. I will tell you that after the crisis is passed, after we've spent these dollars, the real work for the city will begin, because I can assure you, at least the disasters I've been through and all the reconciliation and the audits that take place afterwards are very burdensome to a city. And so we are going to be, on the front end, we have to be very careful about who we allow to be part of allocating and spending dollars that have to then be reimbursed through these federal programs. So we're going to be looking for experienced nonprofits who are sophisticated enough that they can process these dollars and be able to track them and meet the qualifications and the expectations from the federal government. Otherwise, the city will find itself paying back the dollars to the federal government for agencies that can't keep up with these kinds of administrative responsibilities.
Thank you. I believe Mr. Luna wasn't quite done with his question, so go ahead, David.
Thank you, Chris. I appreciate your response to that. My concern is your administrative staff and your staff to be able to go through all of these applications because it takes a lot of work. It takes virtually a year to go through the application process and get that ready just in a normal year. Will you be able to go ahead and repurpose or redirect some of your employees to go and make sure that we're following all the regs? Because these are federal dollars and there's greater accountability to them. And so my concern is I want to make sure that we have sufficient staff in place that we can allocate these dollars appropriately and not have to repay dollars back to the feds.
That's a great question. Thank you, Councilman Luna. Again, that's what we're doing right now. We're going through working with all the departments who have staff that are on the sideline and bringing them on board to either assist Michelle and her group or be on the front end and helping to contact and work through the criteria with the nonprofits. I suspect, Mayor and Council, that some of these programs at the end of the day may be administered by the city directly. We don't typically do that. We've usually farmed that out, but this may be one of those where it's faster and more expeditious for us to take on the responsibility to be a provider for some of these programs if we can't find the capacity to have that done by nonprofits. But you're bringing up great points, but we have a tremendous amount of staff that are underutilized right now. So our first objective would be to engage them. And if we fall short there, I'm sure we'll look for other resources to help us to expedite this. The thing that's making a difference here is the loosening of the criteria by the federal government, the reduction in the amount of time that it has to be out into the public for comments. That's going to shave off a tremendous amount of days that people will notice how quickly we can then get these proposals in and come to council with the recommendations and hopefully get the money out as soon as possible. As you saw, we have some of the funds available now, but the largest portion will be here in about 30 days. So we have some time to try to work through all this right now.
Okay, thank you, Mr. Thompson.
Thank you, Mayor. And that was going to be part of my question too, is the accountability and ensuring that we're keeping track long-term of the funds and transparency of that. But also going back, looking at the fact that, HUD is relaxing some of the criteria now. When you talk to folks like Mark Young, and especially looking at our community right now, with so many people either being laid off or so forth, our community is going to be in dire straits. A lot of our citizens are going to be dire straits, and those that are living right on that edge potentially could fall off of that edge. I just want to make sure that that we have enough funding right now to really help prop those folks up. Because it's easier sometimes to keep someone from falling into homelessness than it is to get them out of homelessness. And I want to make sure that we're looking at agencies like the Mesa United Way that understand, that pathway. But also when you look at the response from Friday for the United Food Bank, Mesa United Food Bank, from an overwhelming response of our public that showed up that are in need. Those are immediate funding that some of our nonprofits really could use now to help our citizens and help those that really are in need.
That is a really good lead-in into the next portion of the presentation. If you'd like me to continue, Mayor.
Yes, but I do have a question myself, Natalie. I hear what you're saying, that we're going to be overwhelmed by proposals from the nonprofit community in our city. They'll see this as a great opportunity for them to step in and assist, and that's great, and that's why we love them, and we are glad that they're in our city. But I wonder if we ought, before the COVID pandemic, I think we were trying to be a little more proactive versus reactive in the way we were funding social services, and maybe identifying, the kind of an RFP type model, saying, hey, we need this, we need this, we need this. Please submit proposals to provide these services, as opposed to, let's wait and see what people ask for, and we'll just rank what the best requests are. I mean, to what extent should that philosophy apply in this scenario?
Let me add to that real quickly. So that's what I meant by saying we have stood up what we call Mesa Cares. So what that means is one of the things we're going to be working on right now with many of those employees who are sitting idle, is what we want to do, and Natalie's already started this, and she's going to share with some of her insights already. But one of the things we want to do is contact all these nonprofits, faith-based communities, individuals directly, so we could get a better sense of the magnitude and the categories of those areas like you're talking about, whether it's homelessness, whether it's rental assistance, whether it's food distribution, elderly assistance. I'm missing a few. So we wanted to understand, try to get the magnitude of the impact in our community, create the categories, come back to council and say, here are the 5 or 6 categories that we've deemed are most critical in our community right now, where people have been impacted by COVID. And then we will then have the nonprofits respond to tell us how are they going to help us provide relief in these specific areas. So that's what we're trying to do, is almost to your point, is not just let them come in with any idea they have. We want to direct them to either helping with rental assistance, or is it helping with utility payments, or is it helping with food, or is it helping with any variety of other issues. But we want to focus on a few, and then have I think the idea is then to have the nonprofits tell us how they're going to help us get these dollars to provide relief in those areas.
Okay, thank you. Council, any other questions before we proceed with the rest of the presentation? Yes, Jen.
An important part of what we're doing with the CDGP and ESG dollars is on mental health. And I just wanted to bring that to everybody's attention and what we can do through our nonprofits or through volunteers and providing maybe an 800 number or a number where people can call to help them weather through this, whether they're in need or not. They could be in mental health needs as we, especially over the next 30 days. I think a lot of people are very concerned about what the world holds when they are told to stay home, and just to have some information, facts, things to help them through this time, the next 30, 60 days of the stay-at-home provisions and things like that. Are we doing anything for mental health for our community as a whole, or can we even use our data that way?
Well, I'm going to ask Michelle to respond. I mean, even though they've relaxed the rules, the qualification of the demographics, I don't think that's changed, has it, Michelle?
It has not, at least what we have seen so far. Now that may change as HUD brings out additional requirements and regulations. But that something could qualify under mental health under the public services. So again, we have to wait and see what more information we get from HUD. But at this point, we could use some CDBG dollars towards mental health.
Okay, thank you.
All right, Mr. Freeman.
Mayor, after listening to the presentation, Michelle, on slide 7, you talk about public facilities acquisition, rehab of facilities, and site improvements. Are there some things that you, I hope it's slide 7, but are there some things, Natalie, that you guys have identified as something that these funds could be directed to help residents in our community? You know, United Food Bank, and I drove by there, and my gosh, I was astounded at the turnout. And I'm sure they were people from different parts of the community, probably not all from Mesa. But I personally would like to see our funds allocated to the residents of our community, and then allocating obviously some funding for the homelessness. But, you know, like, and I agree with Councilmember Thompson when he said, you know, we have families that are on the borderline. If they stay in shelters in effect for quite a while, if you're not self-reliant and have prepared for this, there's families in our community are going to be hurting, and they're going to need financial as well as other assistance, whether it's with utilities, food, even clothing. And I'd like to see a large part of that funding go to the residents in our community, because not to be, you know, the homelessness, I'm sure they could use every dollar we gave them. And at the end of the day, I think we're, you know, fiduciary responsibility to protect and the residents in our community. So that's kind of where I'm leaning. And then again on public facilities acquisition and rehab, did you have an answer to that, either one of you?
Natalie, did you want to go ahead and answer that, or would you like me to?
Yeah, I'll start, Michelle, and you let me know if you want to add something. Mayor, Councilmember Freeman, Vice Mayor Freeman, where we're at right now is looking for ideas and asking for proposals from some of our nonprofits. We've identified 5 major areas of need in the community, and one of them has to do with helping our elderly, for example. And so we've heard from Astor Aging, which used to be EVAR in the past, and they are upgrading their downtown campus, and they're in need of some additional oven, I think a steamer, some other things that will help them do even more as it relates to their Meals on Wheels. So, so that's an example of helping with some rehab or some construction and some dollars that could go toward a nonprofit and help in this short-term time period, but also in the long term as things continue. There are other facilities, existing facilities, and again, no decisions have been made right now. We're in the proposal stage where existing facilities have extra space. And in order to convert that into either additional emergency shelter space or to use for quarantine, there's going to be a need for some rehab and some additional purchases. And so those are the kinds of things that we're collecting right now, so that, again, we're looking right now first and foremost on this emergency and how to be prepared for it and how to get these monies into the hands of our nonprofits so that they can help us when this time comes. But it also gives us an opportunity down the road if resources are available to continue some of this. We won't know that until we get down the road.
Well, just to add, I like the idea of supporting our nonprofits and allowing them, to get some of these monies to enhance what they do. And then by enhancing their facilities, you have long-term, they have long-term opportunities to help whomever they wish and however those monies are given. I guess the question I had again was, I didn't ask it, with the closing of the parks in our community, can any of the funds be used to opening the parks? I mean, we've closed the parks, but can any of them be open? Are any of these funds eligible for the sanitation and the sanitizing, for the labor and everything our parks department and staff have to keep up with the parks? Just asking that question. Mr. Brady, you might be able to answer that.
Sure. So Mayor, Vice Mayor, Council, I think the decision to close the playgrounds was secondary was the cost of cleaning. I think that certainly was becoming an issue for us, and even finding a contractor who was willing to put their employees in a position to be cleaning the equipment. But frankly, the first and foremost was just safety overall of the general public and our employees. And so not necessarily cost, but just kind of going to the theme of trying to prevent high contact areas for the general public and trying to mitigate the spread. Financially, certainly it was an impact, but I think even if we had dollars available, I'm not sure that at this time we would recommend opening up the parks. I think the idea is to send a message that we're trying to really encourage activities where the general public is not having shared contact. I'm not sure what the right word is, public contact in areas. And I think this was just a message to emphasize that to the general public. Now, when we open them, there may be some cost, obviously, to cleaning, but I think at least for the next 30 days or so, 60 days, I think they're going to be, we're closing the playgrounds just to keep people away from gathering and being in close proximity to one another, and obviously in high contact areas.
Thank you. Yes, Mr. Thompson.
Chris, on the topic of, and I know this isn't part of this agenda, but on the topic of parks, is there a way that we can keep the parks open versus just playground equipment? Because, I agree with the assessment that Councilmember Whitaker made last week, which is that, the playground equipment can be a petri dish for viruses and bacteria. But even the CDC recommends, activity outside because the sunlight and the UV rays actually will help kill the virus. I think if people are allowed to be in our parks and exercise in our parks and so forth, but still practice social distancing, that may benefit them health-wise in the long run versus just closing our parks and not allowing anyone in.
So Mayor, Councilmember Thompson, I believe that's what we're following. We have not closed the parks. We've closed the playgrounds. And I guess the equipment, can we say it that way? That's where the tape is, around the equipment. We still encourage people to come to the parks, and as you say, as long as they keep their social distancing, we want them to be outside. We want them to be out exercising on our trails, our pathways, using the large fields, just trying to not gather together. It's really the tape is around the equipment. We haven't necessarily closed a park that I'm aware of.
Okay, thank you. Natalie, maybe before you move on, so my take on this is that we are now in the kind of needs assessment stage, and that we will prioritize what the needs of the community are before we proceed with awarding financing to the proposals. Is that fair to say? And if so, at what point do we shift from, shift beyond being at the needs assessment stage to the soliciting of proposal stage?
So Mayor, I think that's, you put it very well. We need to, again, Natalie and Michelle have done a lot of work already in working with someone, talking to the nonprofits about needs, coordinating with the county about needs specifically related to the homeless and their recommendations. But we're going to go further than that. We're going to go deeper into the community and have conversations. I'm hoping by Thursday we can give the council a little bit of a framework so you know who's working in which areas. So as you're contacted by nonprofits or community members or individuals who have expressed needs or concerns or identified needs, we can funnel those to the right staff. And then maybe in a week after that, then we come back and start telling you, here's what we're hearing, here's the categories. Make sure you're comfortable with establishing the kind of categories of needs. And then we'll develop around those needs, those categories, programs, we'll create those categories. Then those will be the categories which we will solicit proposals from the nonprofits to help us to respond to. So I think if we can move that quickly every week, then by the time the funding becomes available, hopefully we'll have programs almost in place so that we can begin trying to get the dollars out as quickly as possible.
Okay, sounds good. If there are no council questions, I'm sorry, Francisco, go ahead.
Hey, real quick, Mr. Brady, you mentioned something around what the city can do maybe to help the more immediate needs. I know other cities have set up some like sanitizing stations, maybe looking at maybe areas where homeless are, something that we can spend as a city in a more direct way, more immediate to help support that. I don't know if that's some of the items that you're looking at in doing as far as the list that we are compiling for how we can help. And then second, I don't know if the next piece of the presentation will cover, I know the state of Arizona passed a budget that included funds for housing and other services. So do we have any information on that, how Mesa is affected on those actions?
Thank you, Mayor, Councilor Heredia. I'm going to let Natalie answer those. I think she's got a better response than I do on both of those. So Natalie.
All right, thank you, Chris. Mayor, Councilmember Heredia, as it relates to the stations that you were talking about, several of our nonprofits are already looking into that. And they are trying to see if there's ways to get some funding that's over and above what they have for those kinds of uses. I will tell you that it's been difficult for them to find them. They are an item that basically we didn't have a ton of them in the world, and now they're in high need. And so they're hard to find and they're becoming very expensive. But it is something that we're absolutely looking at and in concert with our nonprofit agencies. And as it relates to the state funding and budget, I know Scott Butler provided some updates about that, and there will be some additional ones moving forward. But absolutely, there are monies there too that we think will absolutely apply to our homeless and at-risk populations and in housing in particular for the long term to help people stay in housing, as one of the council members pointed out earlier. So yes, we are looking at that as well, and more information will be forthcoming when we have more details and clarity there.
Okay, thank you. Council, any additional questions before we proceed? Jeremy.
I got one last question, Natalie, or maybe this question is better for Chris, but I know that obviously there's going to be a lot of our facilities that will have to close due to social distancing, right? Like I assume like the Mesa Arts Center, different facilities like that we're going to have a lot of employees. I think to your point earlier that will understaffed or whatever the word you used was. And you also talked about the city running some of these programs. And when we think of some of the basic necessities that people in our community will need, food comes to mind, my mind first. And I know that the food bank had an excellent event last weekend where thousands of people showed up, but can we repurpose those employees so that their time is allocated to potentially I mean, can we purchase food directly, box it up ourselves, and then create, in order to save on that overhead that a nonprofit may incur if we just simply contract out all of these different things that we may see needs for?
So Mayor Councilmember Whitaker, I think those are good questions. I'm not sure that example is one I would use, but I think where you're going makes sense. I think the thing with the food, it has a lot to do with, having all the infrastructure behind it to store the food and be able to package it up and distribute it, and having all the right licensing to handle the food. But we can certainly help out in many ways. I think there's other areas, to your point, that we may look at if the nonprofits don't have the capacity and we have the staff, whether it's rental assistance or whether it's utility assistance or other social services. If we don't see the capacity in our community through the nonprofits, and it's something we can do with our, like you said, with our existing staff, and using that staff that's already available, underutilized and available, that may be our recommendation is, hey, we have the funds are coming to us. We've identified the need. We know who needs it. Maybe we'll self-administer. Now, that takes a lot of work to do that and getting people out of their existing positions, but that's our intent because we want to keep our employees busy and they want to do something to help contribute. So that's what we're working on right now. So the idea, I think we're all on the same page. That's the direction we're heading in. Which category of assistance that we're going to take on, I couldn't tell you, but we are certainly going to look for every opportunity that we as a city, using our existing, like you said, our existing overhead, that we can utilize ourselves.
Yeah, I appreciate that, Chris. And if I could just follow up, I guess specifically the people, it's the hourly employees, right? And I don't know what you guys are doing on the back end. I don't know if we've had that conversation yet, but it's the hourly employees who aren't necessarily getting the hours that they need in order to pay for their expenses. Those are the ones, that I was concerned about. But sure. I'm sure you guys will, just keep that in mind as we move forward. What can we do with those hourly employees? And I'm sure you guys are already thinking about it, but I just want to reiterate.
Thank you.
Thank you. Any additional questions from council before we proceed? All right, seeing none. Chris, Natalie, I'm not sure. I think we're not quite done with this presentation.
Let's let Natalie wrap it up.
I'll wrap it up quickly. So we've talked a lot about the stimulus dollars that it's now called the CARES Act and what we're doing there. This next part of the presentation is about locally controlled federal dollars in our CDBG, in our home, in ESG, and also in our human service dollars. And these are part and parcel to the recommendations that are going to be coming to City Council in the next couple of weeks. As part of that package, we had set aside early on, and you guys probably remember in the briefings that we had about 1.5, 1.6 million putting and investing in homeless types of activities. We have now repurposed those dollars to go directly to the CARES and to the COVID emergency at this point. So we know that things are expected to rise, and we know that we need to try to get monies into the hands of our nonprofits as much as possible. So in lots and lots of conversations with them at this point, we have identified 5 high need categories. And in general, what these need categories are made of are basically system issues, because there are some new services that are needed because of COVID. And they're also really geared towards our at-risk populations, such as our elderly, but also our low to moderate income families that might be losing their job and need rent assistance, that sort of thing. So what we are doing is, you'll see those 5 categories right there. We are asking the nonprofits and faith-based agencies working with our nonprofits to give us proposals for how to respond to these 5 categories. So quarantine space for the homeless, additional capacity for emergency shelters for those who are not identified as having COVID, but might be a high-risk population. Services for the elderly, because we know they're in a very high-risk population. And in Mesa, we want to make sure we're taking care of them. Food supplies and assistance, several of you have talked about that. And then again, this, rent, utility assistance, other types of things that we can do and services we can provide for low to moderate income families who are struggling during this time. We'll be looking at 3 key criteria when we make our recommendations on these proposals. One is, does this directly meet a need for COVID and where we're at right now? What is the agency's capacity and experience in using federal dollars to make sure that they are well experienced in this? We'll also be looking very seriously at Mesa-based priority and services. And I'd probably add one other criteria, which is, can they do this in an expedited way? Because our needs are rising. This is moving very quickly. We want to get these funds into their hands as soon as possible, and we want the service out there for when we need it. So next steps for this short-term assistance is that we're requesting the proposals for consideration. We'll be making those recommendations to the council as part of the federal dollars that will come to you in the next couple of weeks. And then we expect for implementation to occur soon thereafter. And as Michelle said and stated earlier, we would be looking at a reimbursement process that is as expedited as possible to get the $1.6 million immediately out into the community as we continue looking at what happens with the CARES Act and the other state and federal dollars coming our way. So with that, that is the conclusion of our presentation.
All right, thank you very much. I know a lot of work has gone into that. I know you've been hunkered down working long hours on this, both you and Michelle. So thank you very much for the hard work you put into that.
Thank you, Mayor.
Council, any questions before we proceed? Yes, Mr. Thompson.
And just to reiterate, going back to your 5 list, if the criteria allows it, I would really like to see the last 4 on your list take priority over the homeless piece, because I think we really need to look at our citizens and make sure that that our elderly are taken care of, that our community is really taken care of, and I know that we need to also not only find quarantine space for the homeless. I mean, we just need to find space in general for the homeless. But I think we need to make sure that we don't add to the homeless population in our community with everything that's happening right now.
Mayor, Councilmember Thompson, maybe I could also answer the question that you asked earlier in the meeting about whether or not we're tracking the number of homeless that are having and being seen for COVID. We don't have those numbers right now, but what we do know is that the Arizona Public Health Department is tracking those numbers, and they are we're having conversations both at a regional level and then probably at the local level too, to start to share that information with us so that we know. The thing about homeless is this is part of the state's priority because they are such a vulnerable population. They have poor health already and chronic medical conditions, behavioral health conditions like Councilmember Duff talked about earlier. They tend to congregate with one another. They're an aging population. We know that. And so that makes it even more difficult. And they have limited ability to follow public health advice and to really follow hygiene things. So we know that the homeless population is part and parcel to us responding to COVID and trying to slow this down as we work toward it. And these dollars that we have are really geared toward that. They're geared towards, low or moderate income families. So that is still a major priority for us. But also, and so in the proactive way, Councilmember Thompson, but also for the homeless and making sure that this is not, they're not carrying and increasing our risk for the rest of the population as well.
Well, I know that, from previous discussions, the majority, a great majority of the homeless population doesn't really want to be put into shelters. A lot just want to be left alone to do their own thing. And so I'd hate to see a lot of our funding be pushed to a class of individuals that really don't want help when we have an entire society of folks in the low to moderate income, the elderly, that are tax-paying citizens of Mesa that really do need help, that truly need help in this time of crisis.
Sure.
All right, council, any additional comments before we proceed? Yes, Francisco.
Hey, Natalie or Chris, as far as some of these issues, regionally, it's going to be important that we work with other cities. And are those conversations happening as far as identifying similar concerns on what we can tackle together, especially, homelessness is a regional issue that we've been working on with other cities. Given the crisis, I think we can also keep on working on how we identify some solutions there if there's a further assistance that need to happen. But also on rental and housing, folks, no borders on housing and people move around. So if we can, identify some opportunities regionally as we're making some of these decisions, I think that's going to be important for us to maximize the resources that not only Mesa is getting, but the whole valley in the state is concerned.
Okay, I think that's an excellent point. I think we did decide, somewhat before this that we need a regional approach to this. So maybe while we're going through our needs assessment, Natalie, and before we come back, it would be worth, wouldn't it, comparing notes with our neighbors to see if there's some opportunities for collaboration here.
So Mayor, Councilman Heredia, that's already happening. Natalie was on the phone with Phoenix today. There's discussions, again, starting up with Tempe, Phoenix, and Mesa on how we can coordinate on the homeless discussion. I think there's going to be some discussions at the mayor level. I know I was on the phone this weekend with the city manager in Phoenix, comparing notes on a variety of different programs and how we can collaborate on those. So yeah, we get it. We share borders. We're not an island. And so those are great ideas, and we will try to pursue those diligently. And there's definitely a lot of interest from many of our surrounding communities to have those conversations. So we'll, as the mayor said, we had already kind of been in that attitude with Tempe and Phoenix. So the idea is to continue moving forward in that direction.
Thank you. Okay, I'm not seeing any hands. Council, are you ready to move forward? All right, that concludes the discussion of agenda item 2. Item 3 is schedule of meetings. Before I ask Mr. Brady to tell us what he has, if you don't mind, I'm going to take up the opportunity to just say that we have scheduled an online web broadcast for Thursday at 1:30 in the afternoon, directed at the small business community. Sorry. Live television, isn't it great? All right, so it's the Small Business Summit. So it's mesaaz.gov/small business summit, and we're going to be discussing, what we can do what federal resources are available through the recently passed federal legislation, but also questions that small business people, I'm sure, have regarding the stay-at-home order that was issued yesterday. So we just want to help get the word out that, again, this is going to be a web broadcast on mesaaz.gov/small business summit this Thursday at 2. Thank you very much. Mr. Brady, what else do we have on the agenda? So,
Mayor, we will be reconvening a study session again on this Thursday at 7:30 a.m. our regular time. We'll have an opportunity to review the council agenda for April 6th on that day. And then we will also have a presentation following up on budget impacts and providing some information on areas, proposals related to the budget to begin responding now as we begin to contract a lot of our services and projects over the next few months. So we want to kind of review with you that list of things that we're beginning to either postpone or cancel. And so you can see where we're headed in that direction. So those will be some of the items that will be on the study session this coming Thursday.
Thank you, Mr. Brady. Council, anything else you'd like to share with us? Jeremy?
One question on the scheduling. Obviously, we're doing these Tuesday meetings now. Is the plan to have 3 meetings a week when our Monday council session falls on the same week, or will we be shifting our Monday session to Tuesday? Can you guys just give me some idea of what the plan is as far as that goes?
At least for now, I don't know that we thought about that. We just anticipated, at least through the month of April, doing the Tuesday, Thursday, and then when we have a council meeting on Monday, just to focus really that on the agenda. So the study session, the Monday will most likely, we'll keep that specific to the items on the agenda. Right now, if we review the agenda this Thursday morning for Monday, was that April 6th? A Monday meeting, we really don't plan on having a study session other than just starting at 5:30 to go through the agenda one more time before you go into your council meeting. So we'll keep your Monday meeting pretty brief, or just focus specifically on the council agenda and not adding more of these kind of briefings or other study session items on Mondays. If that's okay, council, yeah.
Sure. And of course, council, if you have, want to provide some input or some alternatives to that, please feel free to reach out to Chris and myself. And we just want to make sure that the council feels like it's not suffering from any lack of information or input. So we can do more or less of these meetings if depending on what the will of the council is. Yes, Mr. Thompson.
Yeah, I just want to say thanks to Chris. Make sure that we continue as a council to get daily updates on what's happening. As I know, a lot of our constituents, at least my constituents, are reaching out, wanting to know what's happening and what's going on, not only statewide or countywide, but what are we doing in Mesa? And it's sometimes hard to respond without actually going through and searching all the websites and gathering all this data and information, trying to put it together, and then making sure that we're all on the same page as well, and we're all in the loop. So thanks for ensuring that we're going to continue to get those daily updates.
Thank you. Mayor and council, you should be getting at least Monday through Thursday, maybe Friday, an update from the city manager's office. You'll see it under Steve Wright. And then also the EOC should be pushing out information that they're receiving. Sometimes they'll overlap, but the EOC will have probably more regional and statewide information that they're dealing with. So hopefully you're getting those updates at least Monday through Thursday at a minimum. Sometimes we'll push out a few on the weekend.
I saw Mr. Freeman's hand go up.
Yeah, to tag along with Councilmember Thompson, Chris, uniform messaging on our Facebook page is important so that we all have the same information. Like some of my constituents are reaching out to me and say, hey, am I one of those persons within, can I essential services? And I didn't really know the answer. Oh. So I had to call Andy and say, hey, give me a breakdown. Please put it on my Facebook, which he had done already. And I think he's done it on all of ours. So I think uniform messaging from the council so that we can reach to our respective constituents in the community, I think is important.
Good. Yeah, no, just let us know what those topics are that you're getting questions on, and we can work with Randy to put together a message that you all can put out. Sometimes we're just dealing with the frontline battles here, and we don't know exactly where the community, what their biggest concerns are, but we can, if you'll share that with us and Randy, we'll help him put together a package so we can get that out to everybody.
Thank you. I think Mr. Freeman has something more, and then David and Jen.
Well, yeah, just to follow up like this COVID-19 link, make sure that's on there, because I'm telling people I don't have all the apps, but please look at my Facebook page. And timing is everything, because like everybody's been saying, this is such a fluid issue that we just need the right information timely on our Facebook pages, and then I can respond to that as well. So that's it. Thank you, Mr. Luna. You're up.
Thank you, Vice Mayor Freeman. I appreciate that. One of the things I wanted to make sure is that we don't forget our Spanish-speaking community. We have a large community out there that's relying on information in Spanish. Thank you, Mr. Brady, for giving me some information to post. We want to continue to do that because there is a lot of interest in our Spanish community, and these are very difficult times, and some of these issues are quite complicated. So we need to make sure that we're conveying that message to that community. And I've also been getting messages from my constituents, not understanding what the executive orders is, how to interpret it. And so I appreciate, Chris, your quick response and staff's response as I answer and respond to my constituents.
Thank you.
Thank you, Jen.
My request was also along the same lines, that especially as the governor or the state makes official announcements, that we interpret that for our city and put it out in plain language instead of having a lag, you know, that we need to have that information across our Facebook pages, on our city page, the website, every avenue that we have in social media, so that when these executive orders are made, that we don't leave our constituents scrambling. What does this mean for, you know, my staying at home? What does this mean for my job? What does this mean for me functioning? How is this different from where we were before a week ago? Whatever information we can push forward to provide clarity and consistency, I think would be much appreciated by our constituents.
Thank you. And Mayor and Council, and Mayor knows this better than I do. I think the mayor got a briefing, what, 15 minutes before that announcement, Mayor, what was on the executive order. So we try to respond as quickly as possible, but I think, Mayor, weren't you being briefed almost minutes before he went out on the press conference on that?
Yeah, I spoke with the governor's chief of staff literally like a half an hour before the announcement, and that was when I found out about it. So, but point well taken. I mean, a lot of what's coming out is fairly complicated, and to say to the community, here, go read the executive order, you know, is not, you know, a plain English helpful response, or plain Spanish helpful response to people. So we do need to maybe help people understand that. I'm hoping some of that will take place on Thursday, but we don't want to make people, you know, wait as fast as we can. We need to interpret what's going on at the state level and give some clear, easy to understand direction to the community. So thank you. Those, I couldn't agree more. Points well taken. Okay, Council, before we close the meeting, anything else you'd like to share with us? All right, Mr. Smith has reminded me that because we are meeting remotely, it's important that we do a roll call vote anytime that we have an action item. So is there a motion to adjourn this meeting? Thank you, Mr. Freeman. Is there a second? Thank you, Mr. Luna. All right, we'll now do a roll call vote. I vote yay, and Mr. Thompson, I'll just follow the screens that are in front of me. Mr. Thompson, how do you vote?
Aye.
Thank you. Councilmember Duff.
Aye.
Thank you. Mr. Luna.
Aye.
Mr. Freeman.
Aye.
Mr. Heredia.
Aye.
Good afternoon.
Thank you. Mr. Whitaker.
Aye.
Thank you. Vote is unanimous. We are adjourned. We'll see you Thursday morning.